Hello friends. Today I am going to talk about history of a very important event, that is one of the most important event that happened in history regarding ophthalmology. Now you all know that from ophthalmologist point of view, cataract or cataract surgery is the prime thing. And from patient's point of view also, we have seen that this is one of the most common disease occurring in eyes in human beings. So for ages, we have seen that this surgery was done by removal of the cataract. We get some cues about the old time surgery in Sushruta Samhita, where couching was the method, where the opaque lens was pushed back into the eye with the help of a needle by Sushruta, and that would clear the path, and later on patient would see to some extent, although in that time there were no glasses, because once you remove the lens, then you need thick glasses, because this lens is in itself is a glass. And so from ancient time till 1940s, the only method was to remove the lens, because it has become opaque, because it's cataract, and then prescribe patient with +10 to +12, 13 number thick glasses. So patients were really dependent on these thick glasses. Then as we say that we should learn from everybody, whether it's a child or a learned man. So in this case also an interesting turn occurred in the 1940s. This was when Dr. Harold Ridley in London, UK, was operating in his OT, and there were some interns who were observing him. And Dr. Ridley was one of the renowned eye surgeons of that time. Then once he finished his surgery of cataract, where he removed the opaque lens from the eye, one of the intern asked him, "Dr. Ridley, you have removed lens from this patient's eye, but you haven't replaced it with anything." Now this basic question, I think no one ever thought or asked anybody, and all ophthalmologists were just taking out the lens. And then of course the patient had to wear thick glasses after the surgery, to the tune of +10 to +12. This started a process of thinking and rethinking, although Dr. Ridley has no answer to that intern's questions at that time, but he actively started pondering over this question: how can we replace this lens in human beings? The problem was that we knew that the human lens inside eye acts as a +20 lens, but then we also knew that it's not easy to find a material with which we can make a lens which when we put in the eye would suit patient's body and it will not be rejected. This was the big question bothering all people looking into this world for IOL. And then Second World War happened. Now in the Second World War, Dr. Ridley was posted in war zone, and he was looking after eye injuries happening to pilots. And one fine day, the idea clicked for material to be used for intraocular lens. It so happened that Dr. Ridley was on duty, and a pilot with the air crash injury was brought into his emergency room, and on examination it was found that this pilot who survived an air crash had a piece of some glass material inside his eye. While planning for his treatment, it was observed that although this pilot had a piece of glass in his eye, there was no reaction from eye. And once this was removed, it was found that it was part of the canopy of the windshield of fighter plane. So it was realized that the material with which the aeroplane canopies are made is an inert material for human beings, which can be used for IOL manufacturing. So it was found that this material was PMMA, polymethyl methacrylate, which doesn't cause any reaction when put inside eye. So then Dr. Ridley contacted Rayner company, which was dealing with all sorts of glasses and lenses, and he asked them to make intraocular lenses with PMMA material. And soon the company came out with an intraocular lens with PMMA. And first surgery of intraocular implant, first time in human beings when a lens of cataract was removed and then it was replaced by an IOL happened. This historic day was 29th November 1949, when first intraocular implant was put. The actual video of this event, which was recorded at that time, is available on Google, and I had seen this video in a cassette when I was doing my fellowship in Kiryu, Japan in 1991. And here something interesting happened. The idea was to put an IOL so that patient would need no glasses after surgery or a thin glass after surgery. But surprise was that even when the lens was put, earlier the patients were requiring about plus 10 to 12 glasses, but this patient in whom the lens was put, he also needed plus 5 to plus 6 number glass. So then Dr. Ridley went to physics experts, physics analysts, who suggested, sir, the human eye lens acts as plus 20 lens only once inside the eye, right? But outside in air, when we see in our normal calculation in our lab, the surrounding atmosphere is air. Here the lens number would be different. So then calculations were again done, and it was found that we need a lens which is plus 20 inside eye, and outside it would be a different number. And subsequently the number problem was solved, and he did some intraocular lenses during that time, and some of his students also practiced for it for a few months. But it was found that there were too many complications, because IOL was found, but the surgery to remove cataract for an IOL and then to place an IOL without damaging cornea was not there. So then there was a lull for about 20 years when this was very unpopular, and nobody did IOL surgery because it led to corneal complications, then lens falling back into the vitreous, and there were so many complications. Then in these 2 decades, new surgical procedures were developed, and then we see that in late 60s and 70s, the second era of intraocular lens surgery for cataract began.